So good morning, everyone. Good morning. So I'd like to welcome everybody to the 2019 Housing Summit. We've been really working hard to put this thing together since really about the day after last year's Housing Summit. And we have a fantastic, as evidenced by the amount of people that we have here today and the amount of people that wanted to come that weren't able to be here with us. We have an amazing lineup of speakers we're really excited about. And this is really a time that I feel like for Greensboro that we have the opportunity to try and do some things that are innovative and out of the box, if you will, to try and affect the supply. At the Housing Coalition every day, we have folks coming into our office that are looking for affordable housing to try and rent. And sometimes it takes months, several months to even be able to find something that's even close to what they might be able to afford. So if we're not doing work to impact the supply of housing right now, we're gonna end up in a really bad spot a couple of years from now, and it's already a really bad spot for the people that are looking for housing if you ask them. So you're not going to have to listen to me much today. There's a lot smarter people here that are going to say a lot smarter things than I have to say. But I do want to recognize some of the people that have been putting this on. First and foremost, the staff of the Greensboro Housing Coalition that do the work on the front line every day, that allow me to run around and plan housing summits. We've got them at the front and scattered around everywhere, and they're working mostly at this point. Also, the Dream Team, the planning committee that puts this event together, Karen Biggerstaff, and the rest of the crew. Would you guys stand up? No standing. They're not going to stand, but. Our wonderful Housing Coalition Board of Directors, we have several of our board members here today. For GHC board members, if you're here, could you stand up? And we're going to have our sponsors running on the boards here today, but I'd really like to thank Blue Cross Blue Shield Foundation for their work with this event and for the work that they do to support housing in Greensboro and the work that a lot of our collaborative partners in Collaborative Cottage Grove have been working on over the last couple of years. They made an amazing commitment in a world where funders many times are here and there for a year or two, but they've been with us for quite a long time, and we hope to be with them for a lot longer, and we really appreciate them. We'd also certainly like to thank United Healthcare, Affordable Housing Management, Cone Health and Cone Health Foundation. Cone Health is doing some amazing work with our keynote. We're going to be doing some rounds tomorrow and doing some other things while we're here, and we really appreciate Kathy and the Cone family for all the work that they're doing, as well as Cone Health Foundation for their financial sponsorship of the event. And I can never, the Community Foundation of Greater Greensboro is wonderful. Their work around housing, their work in supporting all of the nonprofits in Greensboro for us to build up our capacity and to be able to do our work, and for sponsoring a large number of scholarships for community members who might not be able to come to the event to be here with us today. So I think I've probably already used up my 3 minutes here. So I'm going to turn it over to our board chair, Dan Curry, for a couple of more remarks. And thank you for being here. And if you see me, grab me if there's anything I can help you with. Be happy to do it. Thank you. Dan?
Appreciate it, Brett. Brett's our Swiss Army knife here in Greensboro. He does just about everything there is to do, and we absolutely appreciate him and the incredible staff at the Housing Coalition. Good morning. Welcome on behalf of the staff and the board of directors of the Greensboro Housing Coalition. I'm terribly excited to see everybody in this room today. Packed house. Wish we had 200 more seats. We could have sold them all. So great job to the planning committee and everybody. Engage, adapt, and change. You're going to hear those words or something like those words all day today, and it's going to be an exciting discussion. Reaching the goal of safe and affordable housing and healthy living, that's not a sprint, folks. As most of you know, we're in a marathon. To borrow a term from NASCAR, they've figured out riding around in circles for 500 or 600 or 1,000 times, whatever they do in their deal, doesn't gain people's interest these days, and so they break all their races into stages. Well, we've got a lot of different stages that we're working on right now. We had a stage win 360 days ago today when Governor Cooper joined this community to open the Greensboro Housing Hub, one of the most innovative co-location housing facilities in this country. And for the last year, the Housing Hub has been serving thousands of families in a more efficient and economical way in this community. We've had stages that we didn't particularly ask for. Tornadoes slicing through East Greensboro. 5 of our innocent children dying in a tragic house fire. Every one of these stages is required that we adapt, we come together, we change systems. One of the exciting things that happened over the last year was that we began the process of changing how we manage housing quality in this community. And it's just a start, but the City Council stepped up in a big way just to begin that process. Today's the next stage in this marathon. I don't know if any of us could have imagined a couple years ago talking about our medical profession, our doctors sitting in a room with a client, and instead of writing a prescription for medications that would treat symptoms of somebody's issues, would be writing prescriptions for healthy local food purchases, or would be writing prescriptions for healthy home inspections for suspected asthma triggers. That's huge change coming to this community and to communities across the country. It's exciting. This is a level of scaled-up change to the largest delivery systems that we have in our lives. It takes unprecedented levels of engagement, cross-sector relationship building, and the exciting piece to me is it's happening right here in our own backyard. A lot of the people in this room today are involved in innovations in this area, and you're going to be hearing this discussion today. That's what's exciting to me to be here today. We have a packed agenda, so I'm going to not necessarily call out the names of all of our elected and appointed officials here, but I will ask if you'll stand as I kind of run through the groups. First of all, our incredible Greensboro City Council members, if you could stand. And stay standing, if you would, please, for just a moment. Guilford County Board of Commissioners, if you would stand up and join them. Any state and federal elected officials, if you would stand and join this group. Now I'd like to ask if you are a member of any appointed board or commission at the local, regional, state, federal level, or if you're a board member, a volunteer member of any nonprofit working in the field of housing, medical, or whatever you're doing in this community, stand up and join this group. Stand up. All right. This is what advocacy and engagement looks like in Greensboro and Guilford County, and we appreciate every single one of you. Everybody here today has a role to play. Please get out of your seats during the day. Talk to folks here in the room. This is the time to connect and enjoy this opportunity. This kind of group doesn't come together every day. So thank you very much and enjoy yourselves today. Who do I? Okay. It's a really great pleasure for me to now bring up and introduce our Mayor Pro-Tem, Yvonne Johnson.
Good morning. You know, when I was a little girl, we used to play May like. We would May like we were movie stars. We would May like we were professors. I don't have to May like I'm happy to be here today. I truly am. This is one of my passions, safe and affordable housing. So welcome on behalf of our mayor, Nancy Yvonne, and I know there's 3 other council people here. Councilwoman Mary Kay Abuzawader, Councilwoman Michelle Kennedy, and our only dude, Councilman Justin Outling. So on behalf of all of us, we welcome you here today. Just 1 year ago, on April 15th, a tornado tore a 16-mile path of destruction through residential neighborhoods on the east side of Greensboro. The community immediately pitched in to help, raising over $800,000 in donations from over 2,000 donors. Emergency response centers provided food, clothing, financial assistance. Local and national disaster organizations stabled roofs, boarded windows, and cut down trees. Families who lost housing were provided shelter. The Storm Recovery Alliance of over 40 organizations, led by the city's Neighborhood Development Department, has coordinated the long-term recovery efforts, providing case management, financial assistance, and housing repairs. Greensboro's history of working collaboratively and the partnerships created by the Housing Hub strengthened our ability to work and plan together. Greensboro was able to come together quickly in a crisis, and we have stayed together for the long haul. The future holds opportunities for transformational change. You will hear some interesting information about that as you go through the day. The medical community is expanding the definition of health care beyond the walls of doctors' offices or hospital. Insurance companies and state agencies are recognizing the investment in prevention, how much that can cost less for our people. Data aggregation can allow us to see patterns and opportunities so that we can strategically respond. Outline platforms such as NC Cares 360 are being created that allow the healthcare system to interact with the service delivery system. On a local level, transformation change is also happening. The housing, our community stakeholders have set a vision that everyone in the community lives in a safe, affordable home. They developed a mission statement to close Greensboro's housing affordability gap through collaborative community action. This year, we will be developing a detailed 10-year affordable housing plan to guide our combined efforts and investments. Invest East is a concentrated effort by the city to encourage and promote development opportunities in East Greensboro and to stimulate new investments through the Opportunity Zones program. $4 million of the 2016 housing bond funds have already leveraged over $82 million in financing for the development or purchase of 541 affordable units. The city's Housing Connect GSO down payment assistance program is on track to create 100 new home buyers in East Greensboro through the 100 Homes Initiative. New models of housing collaboration are moving to solve problems, including the Invest Health Partnership to create an asthma-safe city. And that touches my heart because so many of our children in Greensboro have asthma. The Aging Gracefully, I hope I'm doing that, the Aging Gracefully project is to protect our seniors, and a regional Medicare pilot project for prevention and service includes our housing repairs. A multi-sector team is also working on the systematic issue and changes necessary to bring down the high eviction rate in Guilford County and to improve housing stability. So what can we do? We can continue to grow our connections to each other. We can work on the linkages between our systems. We can increase our capacity for production. We can advocate for an inclusive and affordable Greensboro where everybody can find a place to call home. We can encourage in the City Planet Greensboro Comprehensive Plan update progress to fully realize the vision of our community's future. So a special thanks. I know some of our staff is here. I saw Barbara. I saw several of our staff. So if you just stand for a minute, because these are the people that we rely on when we need something. Well, the Greensboro staff, just thank you so much. And I just see Sharon Hightower came in. Sharon, thank you for being here as well. And I want to thank all of the speakers who have come to share their wisdom and experience with us today, and to the North Carolina A&T State University students, our future designers and builders, who brought examples of their work to share with us. Have a fantastic day. Thank you.
So next up, we've got a new director for the HUD field office. And we just met a little while ago, and we're having a lot of conversations around different types of inspections and REAC and all sorts of initials and HQS and things like that. And I really look forward to getting to know. But we'll bring Jody Moses to the stage to talk to you from HUD. Thank you.
Thank you very much, Fred. Yeah, we love acronyms in the federal government. I think all of you know that. So I'll try to avoid those this morning. I first want to thank the organizers, sponsors, as well as the personnel from the HUD Greensboro office that participated in organizing this event. I have to say, as was mentioned, I'm fairly new to this role, moved to Greensboro in mid-September. My first day was the Monday after Hurricane Florence. So you can imagine me having some second thoughts. I am just, and have been, blown away, frankly, by the depth of commitment and organization participation, as is evidenced in this room today, of the commitment to affordable housing, healthy housing, and all that goes along with that in the city of Greensboro and this community. I venture to say it's unparalleled. HUD, many of you who, if you've been around a while like I have, our role has transitioned a bit. We are a funder, correct. We fund our partner entities and agencies. We provide that monetary support, if you will, in the form of grant funding, everything from our development partners to social service entities, nonprofits, health and human services partners. We also have come to realize at HUD a lot through the fact that our Secretary Carson, comes from the healthcare background, that there's more to success of individuals and families than merely housing. It's safe, decent, sanitary housing and really addressing the entire person. So I bring that up because my role here and our commitment to the city of Greensboro and frankly the state of North Carolina now is to support all of you, our partner agencies, in really looking at that. Abating lead-based paint and making homes safer, particularly for families with children under the age of 6, is high priority for us. Ending homelessness, and when I say just ending homelessness that is driven by poor living conditions for which the individual can no longer tolerate. So that's why I am just amazed at the depth here today, as is evidenced in the room, by all of the current and potential partners I have the opportunity to work with. I do want to take this opportunity to invite all of you to participate in an upcoming event. We've partnered with the City of Greensboro, the Community Development Department, around making homes safer, which is a great caveat from this event, around the lead-based paint and healthy homes program. So thank you.
Good morning. I am Ray Trapp, Director of External Affairs at the North Carolina A&T State University. I got that coming later.
Yeah. And I'm John Louder. I'm the Executive Director for the Piedmont Triad Apartment Association, better known as the third wheel to Ray. And just for a little background, PTAA is a trade association for the apartment industry. We represent about 150 management companies with about 66,000 apartment units across the Triad. Most of those are market rate, so they kind of cover the whole scale from A-class properties down to C-class properties. We do have some affordable housing in our membership, but the vast majority is in market rate housing. So Ray and I were talking about how to kick this off, and I thought I would share a few numbers that we put together for a presentation, that I put together for a presentation a couple weeks ago. And that is the challenge that we have when it comes to housing overall here in the Triad and in Guilford County in particular, is we have a very low vacancy rate, even in the market rate community, and that is, again, across the whole spectrum. We have about a 4% vacancy rate, which is a record low. We also have rent growth that's averaging about 3.5% per year. So let that sink in, 3.5% a year. It doesn't take long for housing to get out of reach for a lot of people. We have actually very strong employment numbers in this area, but we have a lot of underemployment. So you have low income or lower average income matched with rising cost of housing, and you have an issue that I think everybody realizes. And then within that vacancy number, there's a much harsher number, and that's on the affordable side. And the affordable units that we can track, that we know of, there's a 1.5% or lower vacancy rate. And what that means is there's nothing out there on the affordable end for people to move into. We found with the Cone Summit issue last year, we brought a lot of people together to try to address that situation, and Brett alluded to it earlier. It was very difficult to find housing for that many families that quickly. So it's an issue that I think we all recognize that we have, and the question is, what do we do about it? And so with that, I'll turn it back to Ray.
Thank you, John. So today, I want to talk a little bit, and just a snippet, about the university and what we're doing at the university. We are in East Greensboro. We are the leading employer in East Greensboro. And for that, we like to tout our accolades as a university. We're the largest HBCU and also the greatest HBCU in the nation. So we love to say that. Sorry if anybody in here graduated from Central, but it is the truth. So with that being said, we don't want to leave the community around us behind. So we're very aware of our East Greensboro surroundings. So with that, our Chancellor Harold Martin has coined a phrase, and we like to use it, and we're using that for a committee. We have an East Greensboro Renaissance Committee. Through the university, our CFO, Robert Pompey, is leading the charge there. He will lead that committee. It's made up of myself. We have facilities folks involved, and also people on economic development side. So as we grow as a university, we will not leave our community behind. We will not leave East Greensboro behind. And housing is a key component to that. So it's very important that we are here and at the table as far as housing is concerned. Larger, what can we do today? So as we focus and we go through this day, it's going to be great. You'll have great presenters. You'll have great people sitting at your tables that you can have conversation with. But ultimately, we want to leave with what we can do. And the Housing Coalition has done a great job of spelling out some ways and things that you can do. First up is advocating. You have city council members sitting right here. All are great advocates for affordable and quality housing in Greensboro. I may be biased because I was born in Greensboro and I know a lot of these folks personally, but I don't think that there is any other elected body anywhere that advocates for a healthy housing and affordable housing more than the City Council of Greensboro. So give you folks a hand for all that you do. Next up, donate. I know a lot of people don't like to use that and don't like to hear it. It may be taboo to talk about it, but it is money. It is an economic issue. It is an economic development issue. And so we have to be cognizant of that and make sure that we're putting our money where our mouth is. Next up, educate. It's all about educating. John led with some stats, and those are key stats. So we have to make sure that we're educated when we get out and we start speaking about housing and about quality and affordable housing. So making sure that we are touching those three aspects are the start of what we can do. And John will follow up with some other ways you can do.
Thanks, Ray. So I would be remiss if I didn't address why the apartment association's involved. And the reason is that any solution that we come up with has to be a collaborative solution. The housing providers have to be at the table along with housing consumers and housing advocates. So that's why we're here. So the other items that we can address are embrace affordable housing, transportation, and related development projects in your area. The in your area part. A lot of times, you can imagine, I spend a lot of time at zoning meetings at cities across the Triad, and I can tell you that everybody loves the idea of affordable housing until you say you want to build it next to their neighborhood. So we have to get out there, we have to educate, and we do have to advocate on behalf of all types of housing, including apartments. Invest your funds in projects that show promise to increase opportunity and quality affordable housing options for local residents. Same idea. There are a lot of initiatives out there that you can become a part of. I think a challenge that we have is organizing those initiatives and moving in a direction together, but the opportunities are out there. And finally, money's important, but the most valuable commodity we all have is our time. So volunteer your time and expertise to nonprofits and grassroots initiatives dedicated to creating a more equitable housing landscape and supporting affordable housing. It's going to take everybody. Everybody has to get behind this idea and this concept. Without it, we won't go very far. So that's what you can do. That's what we can all do. All right.
Yep. And with that, we won't delay any longer. We've had a great start to this morning and want to continue on. As I look through the agenda, some great things on here. Pop quiz by none other than Councilwoman Sharon Hightower and Cindy Blue from the city. And when I talk about advocacy, there is no louder voice than Councilwoman Hightower. And I mean that literally and figuratively. Then we'll have a student presentation by students from the North Carolina A&T State University. And I'm going to show everyone how to do this. We like to do this when we go places. So students, if you can help me out. Can I get an Aggie Pride? Aggie Pride. So. It's still early. Then we'll have a break at 10:15, followed by the great work in highlighting what's going on in Cottage Grove, a local panel led by Kathy Colville, and I'll address that later. Lunch. Then our keynote by Dr. Megan Sandel, and another panel led by Terry Aiken, followed by a wrap-up by Derek Ellington, who's also a voice for economic development and quality affordable housing. 3 o'clock, we will conclude, and I know we will stay on schedule because I've been told we have a tight schedule and a taskmaster that's going to keep us to that schedule. So with that, no further delay, Councilwoman Hightower, we turn over to you and Ms. Blue.
By the way, Ray, I know your mama and I'm going to tell her. Good morning, everyone. It's certainly a beautiful day. First, let me say before I go further, I am not a morning person. I do not do morning, literally. I'm a better closer than I am an opener. So, let's hope I can make it through this. But I have a great partner, Miss Cindy Blue, to help us out today. I also want to thank Greensboro Housing Coalition. I love being a part of this event because, as Ray said, I am a strong advocate for housing. I represent many in East Greensboro who struggle each and every day to live safe and affordable. And we have to make sure that all people get to a standard of living, that they're comfortable and they raise their families and they invest in their communities. And that's what it's all about at the end of the day, is that everybody lives the life that they were destined to live. And we have to help them get to that place. So yeah, we do need money. We do need people to build, and we need people to be advocates for those who sometimes don't have the loud voice that I do have. And I know God put me here for that reason, to speak for those that sometimes find themselves speechless. But I'm grateful to be able to do that, because to whom much is given, much is required of all of us. If God has been kind to us, we need to pass that on. So, great affordable housing is what Greensboro needs. And thanks to all of you who work each and every day to make that happen. So now we will move on to this fantastic, last year we did this Vanna White kind of thing. I'm not sure what we're doing today.
Yeah, I hope you all have had your coffee. I've had my cup of tea. I'm going to be coming out there looking for some answers.
So you will probably see on the screen, the title of our little bit is called What's in a Zip Code? And so I think the question is on the screen, and then after you all don't know the answer, we'll tell you what it is. But we're expecting some kind of answer. And I do have to, because of turning 60, put my glasses on. So, let's play a geography game. You guys ready? All right. According to the United Nations in 2015, what was the country with the highest life expectancy?
Okay, let's see some answers. Okay, we got Sweden. Where else? I hear Canada, Japan. Anywhere else? Netherlands. Anybody want to guess an age? What's 82? All right, let's survey says. Japan. Who had the Japan? Right here it was. All right, Japan, 83.7 years.
So Ray was close with 82, I think. That was all that I heard. So I'd say, how many on the way to Japan?
Next slide.
According to the United Nations in 2015, what was the country with the lowest life expectancy?
All right, no fair Googling. Let's get some
Yeah,
guesses.
no Googles.
We got a Haiti. Anywhere else? Syria? Yemen? Afghanistan? Do I hear any others? Congo? Sudan? All right, survey says Sierra Leone, 50.1 years. Next slide, please.
All right.
So,
Next question. What are some of the differences that should account for a loss of 33 years in life expectancy? So between what you see in Japan at 83 and then Sierra Leone at 50.
food insecurity, infant mortality, conflict, wars, medical care, listening for some more pollution, water. See somebody from the health department saying water. All right, let's move on.
Did we get an answer? No? We just guessed.
Yeah.
Is that what it was?
Yeah.
Okay. All righty. Don't y'all love it? Gotta love it. All right, close to home. What are the differences in life expectancies between census tracts within Guilford County?
Okay, let's take some guesses. We're looking for a range here. How many? So we had a 20? 6 years? 8 years? 17 years? 12 years? All right, survey says. All right, this is what happens when you ask an epidemiologist for an answer. They say, well, it depends. Well, there's a range. That range is about 15 to 17 years within Guilford County between the high life expectancies census tracts and the low life expectancy census tracts. And that data source, that mortality data from the North Carolina Center for Health Statistics, wow, is that an interesting one. I mean, that is a compendium of all the ways that people expire in Guilford County. All right, let's move on.
Not exactly a fun subject,
No,
is it?
that was not fun.
Not sure. Let's move on a little bit. What are some of the differences that could account for a loss of those 15 years of life expectancy in Guilford County? So why do you think that is, the difference?
And again, we don't have a specific list here, but we'd like to hear some of your ideas and to start sparking some table discussions around these types of topics here.
Right.
A
A lot of people are saying health insurance.
Health insurance, access to food, housing, stress, I think I heard.
All right, y'all got to pump it up. Y'all like me. I get it. Trust me, I understand. More than you know.
A lot of these things have been categorized in a definition from the Center for Disease Control and Prevention. They published a report called I can't read it, Healthy People 2020. Next slide, please. And the definition that they're using for social determinants of health are conditions in the environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So these are place-based things that can affect your life expectancy and the life expectancy of the folks around you. They've categorized these into 5 different key areas. Next slide.
Right, next slide.
Economic stability, education, social and community context, health and healthcare, and neighborhood and the built environment. We're going to take a look at just a couple of pop quiz questions in these areas today to spark some additional discussion as we go through the day.
All right, you ready? Okay. From 2000 to 2017, what was the growth in manufacturing jobs in Greensboro?
I hear a negative. What else do we hear here? 5%? 1%? Anybody want to put a number on it? How many jobs, net growth in jobs in 17 years?
Yeah.
Manufacturing jobs, let's be clear
Give
about
us
that.
a number, yeah. How many do you think we got? 100? 200? 3?
I hear
Somebody says
2,000.
3.
I hear 3.
3. Whoa, we got a lot of work to do.
20,000. Survey says.
26.
So you can see on the graph the effects of the recession that we went through, but still, net growth of 26 jobs in 17 years in manufacturing. We went from 18,034 in 2000 to 18,060 in 2017. And to compound that, that manufacturing sector in 2000 was 15% of the jobs base. In 2017, it's 12% of the jobs base. So that piece of the economic pie is shrinking. And these are the good jobs. These are the high-paying manufacturing type jobs that our economy needs and depends on.
Wow. Isn't Cindy just a Wikipedia?
I've been working on this one for a while.
I tell you, wow. Don't look up Wikipedia, call Cindy Blue. So our next question says, what was Greensboro's ranking nationally for evictions in 2016? What was our ranking?
Let's see who read the news and record this week, because they scooped my data point.
Yeah.
Anybody have any guesses on this one? 9? I hear 9. 13th? Third. I hear a third. 7th? I hear another 7th. All right, survey says 7th in the nation.
First, where?
First in North Carolina. Winston-Salem shows up down there at the bottom of the list at about 16th. The other one in North Carolina.
All right, our next question. What is the approximate difference in life expectancy between a census tract where 85% of residents have high school diplomas versus a census tract where only 65% of residents have high school diplomas?
Okay. How much can educational attainment change the dynamics of your census tract? How many years additional in life expectancy? Do we have any guesses? I hear a 10, 12, 18. All right. Survey says 7 years longer. Yeah.
So education has merit. Give us a little bit more time. So our next question, according to the Greensboro Parks and Recreation Department's newest plan to play master plan, what were the top 3 desired program areas? And we're going somewhere with these questions, ladies and gentlemen, trust me. Doesn't seem like it.
Yeah, we combed through a lot of data to find some of the things that we wanted to portray here today. From your own perspective, what would you want in Parks and Recreation offerings? Trails, I hear trails. Frisbee golf, all right.
Frisbee golf, come to Barber Park.
Programming for young children. I'm going to step on back a row here because pickleball. All right, what else? Swimming. Intergenerational playgrounds. All right, survey says adult fitness and wellness programs, special events and festivals, outdoor adventure programs. People want to get healthy, interact with each other, and be connected to nature.
I need to fall in that, don't I? I need to sign up right away. Bad for a person who lives across the street from the Y not to have a membership. Okay, I'm ashamed. All right, our next question is, all right, lack of physical activity and an unhealthy diet contribute to what 3 leading causes of death in Guilford County?
All right, we got a heart disease here. What else? Ooh, lots of answers, and I can't hear one of them.
Stroke.
Stroke? We
I've
got
had
stroke, heart disease, diabetes, cancer. All right, survey says cancer, heart disease, and stroke, the big 3.
Right on point there.
2/3 of all Guilford County deaths are due to chronic diseases.
So we've got some work we need to do with our health. So question is, according to a recent study, what missing nutrient in diets was linked to poor recovery from cardiac surgery?
Vitamin D, I hear a potassium, calcium, what else we got out here? Iron. I hear a protein. Okay, survey says protein.
Protein, so we need some eggs. We got eggs this morning? Got eggs? Everybody get your plate of eggs?
The CDC recommends that we have 10 to 35% of our calories coming from protein. This particular study was looking at folks who were in the hospital after a cardiac surgery. So it was the time period they were in the hospital and what they ate and how well they recovered. But our friends at Cone Health have also noticed a similar occurrence and are looking into this issue around protein. We are not a community of vegetarians. So a lot of this is access to food and access to healthy food. In the Cone Health Community Health Needs Assessment survey, the most commonly cited reason for not maintaining a healthy diet was the cost of food.
And as you know, we have been deemed a food desert. So we've got to get better food access. And one of the things I'll say, A&T is doing some good work in that regard too, with the things they're doing on the farm and the research and the things they're about to build over there as well. And our community, Cottage Grove, I want to applaud them for reaching out in many ways and creating what I think now is going to be a mobile market to do that, to bring more food access close into neighborhoods, because we have to address that. It's critically important for our life and health and to be able to live. So our next question says, what national ranking did the Asthma and Allergy Foundation of America give Greensboro for asthma-related issues in 2018?
Okay, some guesses here. What national ranking did they give us? I hear a 3,
3.
a 7, 16, 12. All right, survey says ninth worst in the
Ninth worst
nation.
in the nation.
And that was primarily driven by the number of emergency department visits that we have for asthma-related issues. We were 5th worst in the nation for that. So we have a group in the community through a grant from the Invest Health program from the Robert Wood Johnson Foundation that has been looking into how do we reduce the number of asthma incidences due to substandard housing, how do we improve the utilization of medical services and reduce the number of hospital visits for asthma-related issues.
Not a good number. Gotta do better. All right, we ready to move on? So much. Okay, well, y'all waiting on me to read it then, because it's not popping up on my screen. This is what happens when the teleprompter don't work. There it is. How much does a hospital visit for asthma actually cost?
Okay, let's start. We broke it out in 2 ways. We looked at emergency department visits and inpatient visits. So emergency department visits, how much?
How much?
I'm hearing 1,500? Several hundred? 3,000? Inpatient visits. 18,000, 15,000, 20,000. All right, survey says. The 400, now the actual range of this ranged from about $4,000 all the way up to $28,000, depending on whether you were actually admitted to the hospital, whether you're admitted to the ICU. But yeah, we did not count anything associated with ambulance transport. This was solely the hospital cost. But
Right.
if your asthma is being triggered by your home conditions, then this is not a one-time event.
Right.
This is over and over and over again that you're ending up seeking treatment for inability to breathe.
And so can you imagine for a family of 4, who's living off minimum wage? This is devastating cost. And this is why we have to make sure that these homes are healthy for these children to be able to go to school, be able to live at home. I never forget a little incident of and I won't name it was off of English Street. I met a family of small children, and their apartment was infested with roaches. And of course, the children were constantly sick. So when that happens, they're doing the best they can. We have to put them in a better condition and make sure that these children, they were missing school, They're running to the doctor or the hospital, and 4 or 5 visits. That's $2,000 or $3,000. How many people got that right out of their pocket, even in here? Just disposable income. So we must do better. And we will do better. We will get there, won't we, Vanna? All right. Next. Question. According to the recent article in Builder magazine, what are the top 4 must-have features for a new master plan community?
Sidewalks, I hear.
Sidewalks.
I heard green space, I hear lighting. Public transportation and walkability. What would you want to have if you were buying into a new neighborhood? Or
Right.
what would you like to see in your own neighborhood? Access to food? Trees? Public transportation? Age-related accommodations, all right. Survey says, outdoor living, focus on wellness, community connection, and variety of offerings. Where did we just see these same things? The Parks and Recreation Plan to Play program.
Plan to play.
Yeah, people want to get outside, they want to be connected to each other, and they want to be in nature.
They want to live in areas where lots of opportunities are offered to them to just live healthy and safe. So I hope you learned some things today, some things that you probably already knew and some things that you didn't know, and that we take all of this information back to be working toward making this community a healthier, safe place to live. As we go throughout the day, we'll learn and hear much more from others that will be talking about this. And we hope this little bit of fun, was knowledgeable. And hopefully next year, we'll do it in the evening. Thank you all so much.